Many cyclists will be all too familiar with the sense of altered sensation into their hands when cycling. Some may also experience prolonged numbness post-cycling, occasionally weakness in the muscles of the hand or the forearm, and for the unlucky ones, periods of decreased function. Today we're going to be discussing some of the main reasons that this happens, how to recognise the symptoms and signs early, and what to do to stop them, and anything else you need to know in order to get you going back in the right direction, get you back on the road and throwing down some watts as soon as possible. Let's dive in. There are two common nerves responsible for causing symptoms of pins and needles, numbness, tingling, decreased function, weakness into the hands, especially in cyclists. I'm going to be starting off today by going over each nerve individually and what you can do to recognise your own symptoms and begin to piece things back together, starting with the ulnar nerve. The ulnar nerve is one of the nerves which leaves the neck as part of the brachial plexus and travels down the arm, into the forearm and into the hand. Specifically, the ulnar nerve supplies sensation to the medial 1.5 digits, so these two digits here, on both the front and the backs of the hand. And it also has motor functions supplying some of the muscles of the forearm and also many muscles in the hand. And these are shown on screen at the moment. For this reason, symptoms to look out for include loss of sensation in that area, pins and needles, numbness, tingling, sensitivity to the skin in that area, in the area that I've just described, and also weakness of the little finger and the deeper muscles of the hand, leading sometimes to muscle wastage in this area and loss of function, sometimes permanently, unfortunately, if not addressed. The form and function of the cyclist exposes the ulnar nerve to both traction and compressive forces at the elbow and the wrist. And this will potentially lead to this neuropathy that we're speaking about today, and if not treated, progressive symptoms of the ulnar nerve. There are two places where this commonly occurs. Number one is in this area here, is a place called the Guion canal in the hand, and the second place is the cubital tunnel at the elbow. And they're both shown on screen now for a little bit more depth. Typically, it is the prolonged flex position, so that bent elbow position that we experience in cycling, which is responsible for irritation at the cubital tunnel. And the prolonged position of compression in this area here, think about our hand position in certain positions, for instance when on the drops while cycling, which may cause irritation at the Guion canal. The median nerve is also one of the nerves which forms part of the brachial plexus of nerves, once again travelling down from the neck into the forearm and the hand. And specifically the median nerve supplies sensation to the more lateral part of the hand, the palmar aspects of the front of the hand, and it's the 3.5 digits, including the thumb, the index finger, the middle finger, and the ring finger, half of the ring finger. And the median nerve also supplies a lot of the muscles of the forearm. Typically in cyclists, the median nerve is compromised through either, once again, compression or traction forces, specifically at the carpal tunnel. So if you've heard of carpal tunnel syndrome, this is essentially what this is in cyclists. Therefore, it really only, in cyclists really, we're talking about the median nerve being affected past the wrist. Symptoms may include pins and needles, numbness, tingling, sensitivity in the area, as we described a second ago, the distribution of the median nerve, and also the muscles of the thumb can become weak because the median nerve supplies those muscles, and sometimes, if left untreated, can also begin to lose function and waste as well. And once again, like I said, this condition is known as carpal tunnel syndrome. Both conditions can present mildly at first, but if they're left untreated, which lots of people do because they kind of can be mild symptoms at the start, they can sometimes progress to loss of function, as I mentioned earlier. So if you're starting to get pins and needles in your hands whilst you're cycling, get it assessed and figure out what's going on, get a solution, because this stuff can drag on and you can do lots of stuff to avoid it and get yourself back on the bike ASAP. Okay, so there are a variety of things you can be doing to prevent and treat these two conditions. In my opinion, one of the most important things for cyclists definitely to prevent something like this happening is to get a bike fit and get your bike set up to your mechanics. Now, for those who already own a bike, this may mean taking your bike to your nearest bike fitter often at a bike shop or at the osteopath or physio or a local sports therapy practice. Sometimes bike fitters can be based there, and you want to get your bike adjusted to your needs. If you're getting a bike fit pre-purchase and you're in the market for a new bike, this can be done before you purchase the bike, so you can get it all set up ready for you, so when you start riding you've got a bike that's set up appropriate for you. During the bike fit, the fitter will assess your current situation in relation to your flexibility, your biomechanics, your range of motion, and in line with your training goals and any symptoms you may have at the time. And then they can adjust your bike in various ways to make sure that it's more suitable for your use. Now, a bike fit can also be used to improve power, comfort, it can be used to offload injuries and much more. So each bike fit will be different depending on your goals at the time and whatever you present with to the bike fitter. In relation to both the median nerve and ulnar nerve neuropathies from cycling, a key focus may be on setting up the bike to decrease weight bearing through the hands, so overly leaning over the bar, and the wrist compression and excessive elbow flexion positions, which we spoke about earlier. Away from the fit, and certainly for training purposes, I always advise regular changes to bike position when out riding. This may mean switching from the drops to the hoods, to the tops, to maybe to the aero position if you're on a TT bike, to standing, or anything in between. This will help avoid prolonged periods of time in positions which can cause irritation to the nerves, and this is what we're trying to do. We're trying to avoid spending long periods of time in positions which are going to irritate these nerves. If you're on a turbo trainer or an indoor trainer, you can also come up completely into the upright position, take your hands off the bars and just pedal from time to time, and maybe shake your arms out, shake your shoulders out, and you can have a little bit of routine to stretch your wrists out and your elbows out in order to avoid these compressed positions. Now, if you're riding outside and you're doing, changing the position, it may mean that you're going to cycle at a slightly slower speed. But if you shift your focus away from speed and maybe focus on power output, if you've got power meters on your bike, which lots of people have, then you will find that you can get the same training session benefit without compromising the nerves of the forearm and of the hand. So don't let the Strava ego win. You want to spend as much time as you can on your bike. So these little tweaks can help you to train effectively without worrying about risk of injury. In competition, obviously, it's a little bit different. You're clearly going to ride in the most aerodynamic or most powerful position for you. So if you get symptoms beforehand, try and get them resolved before competition, or certainly be aware that if you are competing with such symptoms, they can progress further if they're not addressed. Okay, so we're all grown-ups here. Take responsibility for your own decision making in these situations. You know what's right for you. You know if it's right to compete with certain injuries. If it's super important, you have to make the decision and the call on the day. Whilst riding outside in general, I like to, and I think it's probably a good idea for most people, even in training cycles, to get off the bike every hour or so and shake out. That may be shaking out your arms, your neck, your shoulders, your wrists, your elbows. Once again, it's a good opportunity to get off the bike, avoid those compressive and traction forces that we expose ourselves to when we're in prolonged positions when riding, but also a good opportunity to fuel and, in order to make your ride much more sustainable, and also help with injury prevention as well. One final thing on that is, as these nerves travel close to the skin and can be irritated through prolonged compression directly over the skin, there is some evidence to suggest that wearing padded gloves can decrease risk of irritation. So there are lots of good brands available. Just search cycling padded gloves and you'll find some good brands there. When patients present to me with such complaints, as well as the advice that we've already discussed, I may in the first instance prescribe rest or time off the bike in order to let the symptoms settle. Another good way of doing that, if you want to continue cycling, is to maybe spend some time on your turbo or indoor trainer in a completely upright position, hands off the bars, in order to give your forearms, your wrists, your elbows a bit of a break and let the symptoms settle. As well as that, we may also prescribe either a combination of exercise rehabilitation or manual therapy. Exercise rehabilitation may focus on movement, stretching, control or resistance exercises, depending on the deficits in which the cyclist presents with. Or we may also use some neurodynamic type exercises as well to help with the symptoms. But whatever method we use, it really depends on the cyclist and on what they present with. In cases which are not clear, imaging such as MRI can be used to establish a much clearer diagnosis and rule out any other potential cause for symptoms, or if we think the escalation of care is needed in more progressed cases. There are also some other treatment options which are available to you. Stuff like NSAIDs at the milder end, mild symptoms, you're looking at using NSAIDs to decrease irritation or inflammation. Moving into maybe wrist splinting, there's some evidence to support wrist splinting for carpal tunnel syndrome, same in this situation. If symptoms are quite bad and we're just unable to get on top of them, corticosteroid injections can be used to decrease the inflammation around the nerve. And if symptoms aren't managed well at all and become more progressive, and you've got kind of sensory and motor deficits into your hands, decompressive surgery may also be an option. There is some good news. Both of these cycling-related neuropathies are often self-limiting, which means if they're managed correctly, that you can often avoid any invasive treatments, which is good, and often recover with little issues, which means you'll be back on your bike in no time. If you start getting symptoms, get on to managing them super early, and you're likely to get on top of the issue much, much quicker. And that, folks, is everything that you need to know at the moment about cyclist palsy. I hope that's been helpful and you've enjoyed it, and we will catch you in the next masterclass.